is Transgender Awareness Month, and now it's a time to honor, celebrate, and advocate for the transgender diverse community now and really year-round.
With the ongoing pandemic, those in this community have reported experiencing poor mental health and increased gender dysphoria as a result of canceled hospital appointments. Joining us this morning to talk about gender dysphoria, explain what this is and how we can help those in the transgender and LGBTQ+ community, Benny Tan, the medical director of the Center of Transgender Health. Good morning to you.
Good morning, Vic. Good morning, Lauren. Thank you for having me on the show.
Yeah, of course. So first of all, talk to us about the awareness that, you try to create and the stigma surrounding it.
Well, I was hired by UF Jacksonville in April to set up a Center for Transgender Health here. And my goal is to try and set up a comprehensive care model where we can treat patients with gender dysphoria. Now, as you guys know, gender dysphoria is a feeling of mental and emotional distress when the individual's gender identity doesn't align with their sex assigned at birth. It is quite difficult for these individuals to, in some cases, come to terms. It's quite difficult for their friends and family to come to terms with this. So we're hoping to make this transition easier for them.
What are some of the biggest things that people in the transgender community struggle with right now, especially with the pandemic going on right now?
I think the main thing is getting access to good care. Not everyone has excellent insurance. A lot of patients, due to their gender dysphoria, may not have jobs that would allow them to get good insurance. Now, insurances has started to cover these surgeries for the last 5 to 10 years, but of course, it all depends on what insurance plans they're under. I think getting good insurance and getting access to physicians who can help them with their gender dysphoria is the biggest challenge we face these days.
What exactly I think a lot of people who are struggling with this have a hard time speaking out because they're trying to come to terms with what exactly they're feeling because it's not talked about. What are some of those feelings that usually someone comes to you and says, hey, I'm feeling this, that. Could this possibly be a sign?
I want to kind of talk a little bit, I guess I'll backtrack a little bit about that. Most of the times when patients come to see me, so I'm a plastic surgeon, I help patients with gender dysphoria, help them with surgeries that would better align their body image, I guess, with their gender identity. So most of the times, these individuals would have started by seeing perhaps their primary care physician, who would have then referred them to a mental health provider, such as a psychiatrist or a psychologist, who will then help them with their transition and help them come to terms with their gender dysphoria.
Certainly, it's about having that conversation with your doctor, with your mental health experts, and really, today, we just want to have that conversation, talk about the conversations that normally wouldn't be had. And we appreciate you. Thank you, Dr. Benny Tan, for your time. We appreciate you representing the Center for Transgender Health this morning.
Thank you. Thank you for having me.